Okay, y'all. I had to hide from my kids, so I am stuck in my bathroom recording this. Um, so I'll start with the Glasgow Coma scale. We use it to check the level of consciousness. If the patient can open their eyes, if they can respond to us, if they can follow command. So with eye opening, if they can respond to spontaneous stimuli, if we walk in the room and they're like, oh, hey, open their eyes, they can actually, the Glasgow Coma scale goes off of a score, so 3 being the lowest and 15 being the highest. Highest is the best functioning. So if the eyes open spontaneously, we can score this at a 4, versus if they don't open at all, it may be a 1. There's levels in between there, of course, that involve different types of testing, but I'm trying to cut this short. So level 1 through 4, 1 being the worst and 4 being the best. Now we can assess verbal response. So if we come in and we say, hey, how are you today? Can you tell me your name, where you're at, your date of birth? Do you know where you are? Do you know what year it is? Do you know your birthday? Just any kind of question. Are they alert and oriented? Are they comprehending what we're asking and everything like that? So the highest score they can get on that is a 5, and lowest is 1, where they do not respond to anything, whether it's stimuli or not. They just do not respond. Sorry if you hear my kids in the background. I just heard one scream. So again, 5 being the best and 1 being the worst. Then we do motor response, and if the patient is able to follow commands, we may ask them, can you raise your arm? Can you hold on to my hand? Follow command. And if they do not react whatsoever, they may be a level 1, depending on the type of response we get. And of course, level 6 is actually the highest we can score on that. Anything less than 8 should be considered for, I believe, coma and mechanical ventilation, due to their level of consciousness. And I mean, if they're unable to breathe on their own and things like that. A lot of the times, if it's below 8, then it may be a severe head trauma. And then I think it's below 13, I'm not positive, is moderate head trauma. So obviously correct me, because I'm not positive on that. Now for cranial nerves, I could not get any of my kids to cooperate. They can't take me seriously, and then my husband won't be home till late, and then COVID has us stuck in our homes. So Cranial Nerve One is the olfactory nerve. We can have the patient close their eyes or not. We do cover one nostril. We say, hey, can you smell this? If so, what is it? It's going to be either an alcohol pad or coffee or something not too strong, but with an odor. Cranial 2 is the optic nerve. We look at each eye individually, and we can also test their peripheral vision and their visual acuity. Peripheral vision, we can ask them to look at the bridge of our nose and let us know when they can see our fingers. And then visual acuity for the Snellen chart. The patient should be about 20 feet away, have them cover one eye, and ask them to read the smallest print on the chart. Cranial nerves 3, 4, and 6. Sorry, my cat's trying to get me. Oculomotor, trochlear, and abducens. We test these together. Cranial nerve 3 is actually more function, I believe, with the eyes And this is also where we would assess for PERLA, the pupil's equal reactive or round reactive to light and accommodation. So cranial nerve 3 is oculomotor, cranial nerve 4 is trochlear, and then 6 is abducens. I want to say cranial nerve 4 is the one that controls the superior oblique muscle, and then cranial nerve 6, the abducens, controls the lateral rectus muscle. And we're going to have the patient, we're going to have our pen light, and we're going to check inside their eyes. We're going to check their pupils for symmetry, color, make sure everything's okay. Constriction. So we do that by turning the lights off, have them looking across the room and say, okay, we're going to shine a bright light, and we check each eye. We pay attention to what each eye is doing. And then that's when we'll do the pearl, and then we do accommodation. So to test these nerves, we're going to have our pen light or a finger, and we're going to hold them still and ask them not to move their head. Just follow our pen or finger with their eyes only. We're going to start in the upper right hand corner, and then across, and then lower right, and then we're going to go up to the left, across, and lower left. And then we're going to tell them okay, and then go forward with it. And then, so those are cranial nerves 3, 4, and 6. Cranial nerves 5 and 7 are trigeminal and facial nerves. So we're going to have an object that's either going to be sharp on, or that'll be sharp on one side and soft on the other, like the Q-tips we use. And we can run that across the forehead, the cheek, and the jaw area. And they're going to tell us which sensation they feel, such as the soft or sharp. And we're going to have them clench their teeth, and we're going to have them look up and over, raise their eyebrows, smile, frown. I feel like I'm missing one. Close their eyes tightly. So that's cranial nerves 5 and 7. Cranial nerve 8 is the vestibular, goodness, I can't even think. Vestibulocochlear nerve. It's hard to say for me. So we'll stand behind their, say we start on the left side, we'll have them cover their right ear, and we'll stand on the left side and whisper 3 words into their ear, unrelated words like red, window, tree, unrelated, so they don't just guess, and have them repeat back to us. Cranial nerve 9, the glossopharyngeal nerve, and cranial nerve 10. So glossopharyngeal is about a third of taste is what its function is, and then the vagus nerve, which is cranial nerve 10, is a lot of the gag reflex, and I think a partial part of taste. We test these together. We can use a tongue depressor to check the gag reflex, and then we can have the patient say ah, and we will check the palate on that patient for symmetrical and any kind of lesions or discoloration. While we're already there, I would say we could test the hypoglossal nerve, which is cranial nerve 12. That one, we're going to have them extend their tongue and move it side to side. And then, of course, cranial nerve 11 is the accessory nerve, and we're going to have them raise their shoulders as we have our hands on them, and then we're going to have our hand on their left side of the face and say, okay, can you move your head to the left and head to the right, and we're going to have that resistance right there to see how well that accessory nerve is working. And as we're doing that, we should see the sternocleidomastoid and the trapezius be symmetrical and contract equally. So I try to keep it quick. Please critique me. That way I know where I went wrong and how to fix it, of course. I apologize. I really wanted to do the cranial nerve assessment, but we know how kids are, so that was fun. And I do like these videos. They do help me learn. I mean, I couldn't remember half the names of these cranial nerves, and I always go over them probably every few months, but they're so hard to remember, so I'm glad we did this. And then the Glasgow Coma scale, we never really fully went over it in physical assessment, so this was extremely helpful. Of course, we always check their level of consciousness, but this kind of went into better detail over it, so I really like that. So just let me know. Thanks.